Well, as the country approaches what seems to be the peak of infections, there are concerns that hospitals, both public and private, could become overwhelmed. That's one of the reasons government put forward for the abrupt ban on the sale of alcohol. So, how are hospitals in Gauteng coping? We're joined now by Jacque, Plessis, the Managing Director of Netcare's Hospital Division. Jacque, good evening to you. Thank you for your time. Firstly, at this stage, do you still have space to treat COVID-19 patients in your hospitals?
Evening, Stephen. Absolutely. We still have sufficient space to treat COVID-19 patients. I think it is important to understand that only 20% of patients that contract the virus would need hospitalization. And of that 20%, 25 to 30% would need critical care, i.e. ICU or high care bed capacity.
Are you taking patients from the public sector at the moment? If a patient comes from the public sector, are you able to help out and give them a bed?
Stephen, I'm sure you remember that Netcare was one of the first private healthcare facilities that announced that in extraordinary times and times of disaster, we would stand together with our colleagues in the state sector, and we have certainly offered that we would see those patients in ICU or high care. It's simply a cost recovery scenario. We have a contract with the Western Cape and the Gauteng province, but so far we've only seen a handful of state patients in the Western province.
I mean, at the moment, what we're likely to see, of course, is the field hospitals. They're getting oxygenation, I understand, in the next little while. They'll take some of the load as well. It might be that, in fact, your facilities don't fill up for quite some time.
I hope that's true. However, our actuarial models that we've built, we certainly see that there is a surge. In fact, we are in the middle of a surge. I can tell you that countrywide we've got more than 1,600 critical care beds. We define a critical care bed a ICU or high care where mechanical ventilation can take place on the patient. And we've certainly seen that our resources are stretched. In Gauteng, we've got more than 1,000 beds, and occupancy is around 80%. But importantly, as I say, that we have geared up, and not all patients need that type of care. And a lot of patients can be managed in a normal ward. So what we've done, we've stocked up on ventilators, oxygenators, high-flow nasal cannulas, which can distribute up to 60 liters of oxygen per minute. And a lot of patients can then also be treated in those general wards. Overall, our hospitals are only 50% occupied.
Okay, I mean, obviously this is an impossible question in a way. You say you've drawn up your own actuarial models. Jacque, at this stage, are you feeling confident that you will have enough space for all the people who will need treatment, or do you think that you might need to get a few more resources? Maybe in Gauteng there needs to be another government field hospital?
We are concerned about resources. Resources is not only about beds, it's about oxygen, it's about equipment, it's about doctors and staff, nurses. So all of that, our resources, our actuarial models certainly show that our resources are going to be stretched. But we have, again, as the other speakers have said, we've got contingency plans. For example, we have got 400 anesthetic machines, and if need be, we will actually ventilate patients in our theatres with those machines. We've seen that 2 weekends ago in Port Elizabeth, we had to fly down staff and equipment to cope. And we will do the same in Gauteng between Pretoria and Johannesburg. Pretoria seems to be a little bit spared still at the moment.
All right, and then your relationship with government generally. I mean, you made the point earlier that, that there's been negotiations. How is that relationship going? Are you able to share resources? Is there trust between the two parties? And I realize that, you know, there's a difficult history in some cases between private healthcare and government. It does seem that things might be changing slightly.
We have a very good relationship with our colleagues in the hospitals. The Joint Operation Committees talk to each other. We transferred a number of military patients in Johannesburg recently, and we certainly stand ready to help our colleagues. I think The challenge is that this is not a once-off a train disaster or a big accident, and we certainly would make available our resources as and when the need arises, as we have resources available.
Jacque, Plessis, do appreciate the time. Thank you, Managing Director of Netcare's Hospital Division.